Okay, this is examination. Let's say we needed to do an exam on a patient. Simply touch exam. It brings us to our patient list. We can of course change the date if they need to be. And we're going to use our friend Harvey Lillard again. Simply hit continue, make sure he's highlighted, and it says please choose the area of examination. You can do neurological tests, vitals, palpation findings, all different types of things. But we're going to say we're going to do cervical exam, and you can see all the different options we have here. We're going to hit Valsalva, and we're going to say it was within normal limits. There's nice, beautiful pictures in here, and a procedure, exactly how it's done and what exactly is a positive finding. One of the things I learned while I was making this is a lot of things I thought were positive findings really aren't. So I'm going to say it was within normal limits. We're going to say Rust sign was within normal limits. We're going to say Desjardins sign was within normal limits. And we're going to say foraminal compression. Perhaps he had localized cervical pain on the left, so I just simply touch that. Maybe we could do grip strength. We could do maximum cervical compression. Let's go ahead and select that one. And we're going to say again positive on the left convex side, so I simply select that. I could do range of motion this way. I could do, go ahead and hit that and say if normal is 50 plus degrees according to the AMA, and we're going to say he was right at 50 with no pain. And we're going to say extension was 60 degrees, but you know what? He had pain and no area. No area means I'm not going to select it. So this time I will pick an area. So I'm going to say 80 degrees, pain and area. And I'm going to say into his left arm, or left mid-cervicals. Now it says right rotation, we're going to say 80 degrees with no pain. And we're going to say left lateral flexion, we're going to pick 45 degrees with no pain. And maybe right lateral flexion was decrease, and we're going to say 35 degrees with no pain. And it's that simple, with simply touch done. All of these different orthopedic exams are all done in the same way. If you wanted to do neurological exam, you go ahead and hit neurological. You could either do cranial nerves, reflexes, or dermatones. If you wanted to do cranial nerves, you would simply select cranial nerves. And if you found that cranial nerves 2 through 12 are all within normal limits, simply select that button. And same thing with reflexes and dermatones. When you're finished, hit done. Perhaps we did some malingering tests, or why don't we pick some lumbar tests? Hit lumbar. Maybe we did Kemp's. Maybe it was within normal limits. Eli's. Maybe it created pain in his left thigh. Minor sign, we'll say was not present. And we could do range of motion if we wanted. Valsalva, again, was within normal limits here as well. Brzezinski sign, perhaps that was within normal limits too. And maybe bowstring sign, there's one I don't do very often. And maybe he had low back pain from the left leg. And Manel's was within normal limits. When we're finished, we simply select no more lumbar tests. This is great to have all these pictures because it gives us an opportunity to remember all these things in little reminders. I don't know about you, but I get into my routine and I don't always associate the proper name with the proper test unless I'm gently reminded. When we're finished, simply select done, and there we go. Tremendous amount of information about the exam that was performed. If you want to, you can hit pause right here and have an opportunity to read some of this, some of the notes that were just done. To sign on the screen, simply select Doctor Sign on Screen, and then go ahead and put your John Hancock on there. Select Insert Signature, and it's finished. When you're finished, you could either print it out, you could hit exit. I'm just going to hit exit and return back to the start screen.